Well, hello everyone. This is Nurse M. I really wanted to do something to try to help the nursing community. I don't care if you're an RN, an LPN, a CNA, a care worker, you work in the kitchen, if you do cleaning of rooms, I don't care what your profession is. This is very important information that's been going on for quite some time. It's gotten progressively worse over the last decade and even more seriously bad since the pandemic. My concerns are regarding lack of staffing, lack of resources, lack of common sense, if you will, when it comes to especially long term care and skilled nursing facilities, rehab facilities. Um, we're going to be I'm creating this channel in order to try to make a change and to try to get a discussion involved regarding at least getting this discussion on the table with our states, with our government. Did you know that California is the only place where there's safe or standardized nursing to patient ratios? And I don't even know if those go into long-term care or skilled nursing facilities. The majority of these are all hospital-based. As most people are well aware, the acuity of care that are in long-term care and in rehab facilities has gotten quite great. Um, I just kind of wanted to share with you a little bit of what the guidelines are. Since I'm in Florida at the moment, I'm going to share a little bit of information for y'all, just to see what the government seems to think is okay for staffing levels to be, at least in the state of Florida. I am not a Florida native. I have absolutely um, no long-term ties here, no axe to grind. But being that I traveled here looking for a warmer, more pleasant environment since I'm from up north, I want to tell you a little bit about what I've run into in the southern states. It isn't just Florida. This is a nationwide problem. If you see here on my screen here, the Florida nurse to patient ratio in long-term care facilities, it says right on here, 1 licensed nurse per 40 residents. They consider that to be safe. In this setting, there is no mention of acuity of care, the acuity of the patients, meaning how injured they are, how ill they are. You know that hospitals are sending sicker and sicker residents or patients to nursing homes for either rehab or for long-term care, which require a lot of knowledge, a lot of medication, a lot of treatment. A lot of times there's IVs involved and wound care and you name it. It's like a step down unit from a hospital, especially in the skilled nursing sector. I wanted to bring to your attention that in these facilities, it's a minimum of 40 residents per 1 nurse. Now, I want you to think about that for a minute. 40 residents getting medications several times a day, a lot of them with wound care that needs to be done, a lot of them with needing help getting up, using the washroom, getting bathed, call lights that need to be answered, water pass, you name it. It all takes manpower and it all takes a team environment. But this particular scenario, while it's not as bad as this, in the couple of places that I've worked at, I'm a travel nurse, um, but it's really close and borderline. I don't want to say negligent, but all it takes is just one little thing to put everything on the back burner and have everything kind of blow up on you a little bit. It causes a very stressful work environment. You're torn between having to get medications out within a 2-hour window. You can either give medications an hour before or up to an hour after. Now you're thinking to yourself, Nurse Sam, How is a nurse supposed to give all of these medications to 40 people in 2 hours? Well, 2 hours is 120 minutes, right? And if you have 40 patients, that leaves about 3 minutes per patient where you have to verify their meds, pop their meds out, make sure that the patient is meeting the parameters for their blood pressure or blood sugar or whichever parameters are for whatever medication people are having. Um, Explain to the patient what's going on, be able to set up an IV if needed, give insulin if needed, and go on to the next person. Can you imagine what kind of a nightmare that is and how stressful it is and how rushed you would be? Let's say it's the usual, which I've found in Florida, which is roughly between 28 and 30 patients per nurse and long-term care side. During the night, I've done some night shifts, and I've had about 40 patients during the night. That doesn't change the fact that they need medications or cares or dressing changes. It doesn't stop there just because it's nighttime. In that case, I've had about 38 patients, which can be really, really hard considering most night shifts we run on kind of a skeleton type crew. Um, but let's take the more generous portion and say that we're doing 30 patients and you have 2 hours, that's 120 minutes. That leaves you 4 minutes per patient to give them their meds on a timely fashion. It's considered a medication error if you give a pill before the hour window or if you give a pill after the hour window. On either side, if a med is due at 8 o'clock, you can start passing those meds at 7 o'clock, and you have until 9 o'clock that morning to make sure that all of these patients get their meds. Now, I'm kind of a realist here. I'm telling you, unless this person knows exactly what those medications are, which is a danger in and of itself, it causes for changes in medication dosages not to be recognized and possible medication errors to happen. I'm telling you straight up, that's a dangerous, dangerous thing. Also, I just wanted to go over our hardworking, very hardworking nursing assistants that we have. Now, can you imagine the life of a nursing assistant? All of us nurses have been either trained as a nursing assistant or have been nursing aides ourselves. Having 20 patients in order to get up every morning, make sure that they're bathed, dressed, changed out to breakfast, or have their breakfast delivered to them. In some cases where I've worked, even had to make them a continental breakfast, whether it's cereal or eggs or whatever, deliver it to them. Do that times 20 people after morning cares, after everyone's been toileted, and then do it all over again for lunch. And get all of their charting that's required by the state to get done, not to mention answer call lights to take people to the bathroom because, our bladders don't work on a schedule, right? What I'm trying to get across here is we need to make a change, and the only way that the change is going to happen is if we actually all stand up together and say no. No more. You need to make this a safe environment. I've heard all the little lines, all the little stories from a lot of nurses saying this is just the way it is. This is what we've got to put up with. And I'm saying no because I know that people saying no and standing up, even to the point of having to leave a facility, has worked. I'm not saying stage a walkout. I'm not saying go in and protest out inside of your facility. I'm just like simply don't apply for places that don't have safe nursing ratios. And if you're in a place that has an unsafe nursing ratio, make sure you speak to management. Make sure you make your needs known, and make sure you stand up for the people that we're paid to stand up for. A lot of things got brushed under the bus. I understand with COVID how we went down to skeleton crews, and my whole worry during that whole time is, and still was and still is, um, If they can see that you can cut corners and move faster with fewer people, they're not going to hire the staff that they need to have a functioning facility. I wanted to draw your attention to mental health problems as well as physical problems that a lot of nursing staff face that won't talk about it. It's a sign of weakness or just part of the job. Work-life balance, mandates. We need to come together as a community all and have a safe place to talk about this and come up with ways to make things change for the better again. I wanted to also show you one other thing here. And this is just one random thing that I picked up. All right. I just picked up one random place and did an employee review on it. This is just one random place. I deleted all of the pertinent information. This is from an LPN from earlier this year. Let's just say there's some good people in the building. The CNAs run the building and management pretended to care, but don't advocate for us as they should with corporate. Pay is a joke for the stuff you have to deal with, to include call-outs, resident issues all the time. You ask for an evaluation, you get the runaround. It sucks when you see their pay scale on Indeed and you're getting the bare minimum when you work extremely hard and do most to be a team player. Now, I've seen this before. I'm living proof of this stuff. And to be quite honest with y'all, I really, really am scared that if we continue on the way that we are, things are only going to get worse. You need to remember our licenses are on the line, and I'm reaching out to everybody to please, please pay attention. I'm going to have an ongoing channel here. Want to work together. Want to be the change that we want to see. We've become too complacent, y'all. We've been accepting the heavier workloads. We've been accepting the extra job responsibilities. We've been accepting all of that stuff. And it comes at a cost. It comes at a cost to patient care. It comes to a cost of the stress levels in our life. It comes to a cost at every possible level. I just want to leave you with this little tidbit. I will be posting some more later on. And hopefully we can get a community together. Please feel free to reach out. Please subscribe. Please leave a comment. That way the algorithm will send this out to more people that have an interest in this type of thing. And we can get a community going and see if we can make a change. That's all I'm asking for, is a chance to make a change. Please let me know what you would like to discuss in the comments. That would be fantastic. In the meantime, take care, y'all, and be good. Thank you.